Welcome back to the Vital Signpost. It's time for another deep dive, and today, well, we're tackling central nervous system stimulants. Now I know what you're thinking. Stimulants, isn't that like basic pharmacology? But trust me, there's a lot more of these medications than meets the eye.
That's right. Whether you're a seasoned nurse or just starting your journey, understanding CNS stimulants is absolutely essential for safe and effective patient care. We're going to delve into how they work their magic on that intricate network of neurons and neurotransmitters.
And, as I was prepping for this, I was honestly surprised by some of the things I learned.
Oh, I bet. It's a fascinating area.
It is. For instance, did you know that caffeine, yes, that caffeine, the stuff in your morning coffee, is used in the NICU?
Oh, absolutely. It's a real lifesaver for those tiny, premature babies struggling with apnea.
Exactly. And then there's this whole connection between migraines and narcolepsy, which I never would have guessed.
It all comes down to the central nervous system, really. Once you grasp the intricacies of how it functions, you can see how these seemingly unrelated conditions and treatments actually intertwine.
So before we get ahead of ourselves, let's take a step back and refresh our memories on the CNS, brain, spinal cord, the command center of the whole body.
Right, and at the heart of it all are neurons, those specialized cells that transmit signals throughout the body. And those signals are carried by our friends, the neurotransmitters.
Ah, yes, neurotransmitters. They always seem so complex back in nursing school.
They can be, but think of it as a delicate dance of signals. Some are excitatory, like dopamine and norepinephrine. They're the ones saying, go, 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 increasing activity in those neurons.
It's like stepping on the gas pedal.
Exactly. And then you have the inhibitory neurotransmitters. They're the brakes, calming things down, preventing everything from going haywire. GABA is a prime example of that.
So it's this constant interplay of go and stop signals, right?
Yeah.
This fine-tuned balance.
Precisely. And that's where CNS stimulants come in. They tip the scales towards excitation, sometimes by boosting those excitatory neurotransmitters, sometimes by putting a damper on the inhibitory ones.
So it's not just about making the whole nervous system run faster. It's about targeting specific areas and, in a way, tweaking their activity.
That's a great way to put it. And because of that, we see CNS stimulants being used for a wide range of conditions, each with its own unique mechanism and therapeutic goal. It's not just about speeding things up.
Okay, that makes sense. So let's get specific. Let's talk about some conditions where these stimulants can really make a difference. Conditions that we, as nurses, encounter all the time, like, say, ADHD and narcolepsy.
Absolutely. Imagine a child struggling to focus in school, constantly fidgeting, unable to sit still, or an adult whose sleep disorder makes daily life a constant battle against overwhelming fatigue.
It's hard to even imagine.
It is, and in these situations, CNS stimulants can truly be life-changing.
But like any potent medication, there's always a flip side, right?
Yeah.
Potential risks we need to be aware of.
Precisely. And with CNS stimulants, safety is paramount. We're often talking about Schedule II drugs here, medications with a high potential for abuse and dependence.
So careful patient selection, monitoring, and education are key.
Absolutely crucial, every step of the way. Now, to understand how these drugs work for ADHD and narcolepsy, we need to look at the neurotransmitters they target. For ADHD, the stars of the show are often amphetamines and methylphenidate, think Adderall and Ritalin. They primarily increase dopamine and norepinephrine in areas of the brain that control focus, attention, and impulse control.
So they basically boost those signals that help with, well, staying on track and controlling impulses.
Exactly. And then there's modafinil, commonly used for narcolepsy. Now, this one takes a slightly different approach. It mainly targets GABA, that inhibitory neurotransmitter we talked about, the brakes, if you will. By reducing GABA's influence, modafinil helps keep the brain alert and staves off those sudden, overwhelming sleep attacks.
So it's kind of like easing up on the brake pedal, allowing the brain to stay more awake and engaged.
A good analogy. But here's the thing. Even though these medications are often effective, tolerance and dependence can still develop over time. That's something we always have to be mindful of and manage carefully.
And that's where strategies like drug holidays come into play, right?
Yeah.
Especially for kids, giving their systems a break.
Exactly. Drug holidays can be really beneficial in minimizing potential long-term side effects and also helping to maintain the effectiveness of the medication over time. It's all about finding that sweet spot, that balance between benefit and risk. And that can take some careful fine-tuning.
Okay, that makes a lot of sense. Now let's shift gears a bit. Let's talk about another condition where CNS stimulants play a role, one that's incredibly prevalent and something we, as nurses, see every single day: obesity.
Right. And with obesity comes a whole host of other health problems: diabetes, heart disease, certain types of cancer, the list goes on. So finding safe and effective ways to manage weight is absolutely crucial.
And that's where medications called anorexians come in. Basically, appetite suppressants. And I have to admit, I find the way they work pretty fascinating.
They are pretty remarkable. Some anorexiants, like phentermine, work their magic in the brain, specifically those appetite centers. And you guessed it, dopamine and norepinephrine are involved here too. By tweaking those pathways, they essentially dial down those hunger signals, making it easier to stick to a reduced calorie diet.
So it's not just about willpower, it's about working with the body's own mechanisms.
Exactly. But then you have a medication like orlistat, which takes a completely different route. It doesn't touch the brain at all.
Really? That's surprising. So how does it help with weight loss then?
Well, orlistat gets down to business in the digestive system. It specifically targets the enzymes that break down fat, blocks them, actually. So a portion of the fat you eat just passes through unabsorbed.
Wow, that's a completely different approach. I imagine it comes with its own unique set of side effects.
Let's just say that clear communication and setting realistic expectations are key when it comes to orlistat. The side effects, while usually not serious, can be memorable, but for some, it can be a really helpful tool.
All right, appetite control, check. Now let's talk about another condition where CNS stimulants are a game changer: migraines. And we all know these are way more than just a headache.
Absolutely. They can be completely debilitating, impacting a person's entire life. And for many, especially women, they're a recurring nightmare, often striking without warning, lasting for hours, sometimes even days. The pain can be excruciating, coupled with nausea, sensitivity to light and sound. It's truly awful.
And I'm so glad we've seen some major progress in how we treat them. And guess what? CNS stimulants are front and center.
Right. Triptans, which are serotonin receptor agonists, have really revolutionized migraine therapy. They essentially work on two fronts. First, they constrict blood vessels in the brain, which seems to play a big role in that migraine pain. And second, they reduce those inflammatory substances that add fuel to the fire.
So a double whammy, tackling both the blood vessels and the inflammation. This is what we call abortive therapy, right?
Yeah.
Stopping a migraine in its tracks.
Exactly. Now, there are other medications like ergot alkaloids that have been used for migraines, but triptans are now the go-to for most people. Generally safer, more effective, a win-win.
But of course, as with any medication, there are always things to consider. I know triptans, because of that vasoconstriction thing, can be problematic for people with certain heart conditions.
Absolutely. Anyone with a history of cardiovascular disease needs to be very carefully evaluated before even thinking about starting triptans. Weighing the benefits against the potential risks is crucial.
And it's exciting to see all the new developments in migraine treatment. I was reading about CGRP inhibitors, which have a completely different mechanism. Sounds promising.
They are very exciting. Definitely a topic for a future deep dive. But for now, let's switch gears again to a place where you might not expect to find CNS stimulants, the NICU.
Right. That whole caffeine for preemies thing, I have to admit, it blew my mind when I first learned about it.
It is pretty surprising. You see, preemies often have these pauses in breathing called neonatal apnea. It can be pretty scary, and caffeine is surprisingly effective in helping them breathe more regularly.
So it's more than just a morning pick-me-up. It's actually stimulating those essential breathing mechanisms in the brainstem.
Exactly. It acts as what we call an analeptic, a drug that stimulates those respiratory centers. Now, there are other analeptics besides caffeine, like doxapram. Much more potent, usually reserved for emergency situations in adults, things like respiratory depression after surgery or a drug overdose.
But doxapram is a no-go for newborns, right, because of that benzyl alcohol component.
Absolutely. Benzyl alcohol can be toxic to newborns, especially preemies. It can cause a serious condition called gasping syndrome. That's why caffeine is the preferred choice for those tiny patients. It's all about finding the right tool for the job and understanding the nuances of each medication.
Wow, we've covered a lot of ground already. From the basic mechanisms of CNS stimulants to their diverse uses in ADHD, narcolepsy, obesity, migraines, and even neonatal apnea. It's amazing how versatile these medications are.
It really is. But as we've seen, it's not just about knowing the drug names and dosages. It's about understanding those intricate workings of the central nervous system, appreciating the potential risks and benefits, and always putting the patient's well-being first. And that, my friend, is the essence of skilled and compassionate nursing care.
Couldn't have said it better myself.
So we've talked about these medications in a broad sense, those big picture categories. But now let's zoom in a bit. Let's get into some specifics, the nitty-gritty details that you, as nurses, need to know to provide that safe and effective care.
Okay, I'm ready to get granular. Where should we start?
Well, how about we start with those amphetamines we mentioned earlier? They've been around for a while, have a bit of a, shall we say, mixed reputation, but their effectiveness for ADHD, that's undeniable.
Yeah, they're definitely a mainstay in ADHD treatment.
Absolutely. You have amphetamine sulfate, which you might see as dextrine, and then there's the mixture of amphetamine and dextroamphetamine salts, the one everyone knows as Adderall, been used for decades and for good reason. And the beauty is they come in both immediate release and extended release formulations. Gives us a lot of flexibility in tailoring treatment to the individual patient.
All about finding that right fit, right? The right dose, the right formulation.
Precisely. But we can't forget that these are Schedule II drugs, those with a high potential for abuse and dependence. So vigilance is key. Careful patient selection, monitoring for any signs of misuse, making sure patients understand the risks and responsibilities, that's all part of our job.
Absolutely. We're the gatekeepers, in a sense.
Mm.
Now, switching gears a bit, let's talk about atomoxetine. It's a bit of an outlier in the ADHD world, right? Not technically a stimulant, but still effective.
That's right. Atomoxetine, or Strattera as it's often called, works a little differently. It's a selective norepinephrine reuptake inhibitor. So it mainly boosts norepinephrine levels in the brain without directly affecting dopamine. Kind of like fine-tuning a specific channel in that complex communication network.
Interesting. So it's a more targeted approach, perhaps, and I imagine because it doesn't have those stimulant effects, the risk of abuse and dependence is lower.
Precisely. It can be a good alternative for patients who don't tolerate stimulants well or have concerns about those addictive properties. It's all about having options, right? Finding what works best for each individual.
Absolutely. Options are good. Now, let's talk about something a little more familiar, something most of us probably consume daily. Caffeine.
Ah, yes, the universal pick-me-up. But caffeine is more than just a morning jolt. It's a mild CNS stimulant, and it actually has legitimate therapeutic uses.
Oh, absolutely. We talked about its use in the NICU earlier.
Right, for neonatal apnea. But it's also used for other things, migraines, for example. Sometimes it's even combined with pain relievers for that extra boost. And the way it works is fascinating. Caffeine essentially blocks those adenosine receptors in the brain.
Adenosine. That's the one that makes us feel sleepy, right?
Exactly. So by blocking its effects, caffeine increases alertness and wakefulness, makes you feel more energized, ready to take on the day. Or, in the case of those preemies, helps them breathe more regularly.
It's amazing how one substance can have such diverse effects. Now let's move on to another analeptic, doxapram. This one's a bit more heavy-duty, right? Not your average cup of coffee.
Definitely not. Doxapram is much more potent than caffeine. We're talking emergency situations here when someone's breathing is dangerously depressed after surgery, a drug overdose, things like that. Usually given intravenously, works very quickly.
A red flag for newborns, right? That benzyl alcohol thing again.
Absolutely. A big no-no for babies, especially preemies. But for adults in crisis, it can be a lifesaver. It's all about choosing the right medication for the right situation. And understanding those contraindications, those situations where a drug is off limits, is crucial.
Now let's talk about another ADHD heavyweight. Methylphenidate. Ritalin, I think most people have heard of that one.
It's certainly one of the most well-known ADHD medications, and it works similarly to amphetamines by increasing dopamine and norepinephrine in the brain. Helps with focus, attention, impulse control, those key areas where people with ADHD often struggle. And like the amphetamines, it comes in a variety of formulations. Immediate release, extended release, even chewable tablets, lots of options to personalize treatment.
That's great. Having those different options can make a big difference in terms of patient compliance, too.
Absolutely. But as with any stimulant, we have to be mindful of potential side effects. Insomnia, decreased appetite, anxiety, those are things to watch out for. Monitoring, education, those are key, always.
Now, switching gears again, let's talk about modafinil. It's kind of in its own category, isn't it? Not typically used for ADHD, but the go-to for narcolepsy.
That's right. Modafinil, often sold as Provigil, is what we call a wakefulness-promoting agent. It helps people with narcolepsy stay awake and alert during the day, reducing those sudden, uncontrollable sleep attacks. And unlike some of those traditional stimulants, it doesn't seem to have the same potential for abuse and dependence.
Oh, that's interesting. So it's almost like a gentler approach to promoting wakefulness?
You could say that. It's thought to work by increasing dopamine levels in the brain, but in a more subtle, targeted way. It's not that jolt to the system that you get with some stimulants.
Okay, I'm starting to see how nuanced these medications can be and how important it is to really understand those individual mechanisms. Now, let's move on to another category we touched on earlier, the anorexiants, those appetite-suppressing medications used for weight loss.
Right. And one of the big names in that arena is phentermine. Been around for a while, and for some people, it can be really effective. It works by increasing norepinephrine and dopamine in the brain, similar to amphetamines. This leads to a decrease in those hunger signals and a bump in metabolism, which can contribute to weight loss.
So it's working on multiple fronts, helping people feel less hungry and boosting their calorie burn.
Exactly. But it's typically used for short-term weight management, and it's a Schedule 4 controlled substance. So again, that potential for abuse and dependence is something we need to be aware of.
And it's important to emphasize that medication is just one piece of the puzzle, right? Lifestyle changes, diet, exercise, those are essential too.
Absolutely. Medications can be a valuable tool, but they work best as part of a comprehensive approach. Now, another weight loss medication we should talk about is orlistat. And this one is completely different from phentermine. It doesn't work in the brain at all.
Oh, that's right. We talked about that earlier. It works in the digestive system, right? Yeah. Blocking fat absorption.
Precisely. Orlistat, sometimes called Xenical or ALI, is a lipase inhibitor. It basically blocks the enzymes that break down fat in the intestines. So instead of reducing appetite, it's preventing the body from absorbing a portion of that fat.
Interesting. So the fat just passes through.
In a manner of speaking, yes, it can lead to weight loss, but patients need to be prepared for some potential gastrointestinal side effects.
Right. Those side effects can be a bit, shall we say, delicate to discuss. Yeah. But honesty and clear communication are key.
Right, absolutely. Setting realistic expectations is essential. But for some patients, the benefits outweigh those downsides. Now, let's switch gears yet again and talk about a class of medications that have been truly transformative for many migraine sufferers.
The triptans.
Ah, yes, the triptans. I remember learning about them in nursing school. They've really changed the game for migraine treatment. They have. Sumatriptan, often sold as Imitrex, was one of the first, and it's still widely used today. Triptans work by targeting specific serotonin receptors in the brain. This leads to vasoconstriction, the narrowing of those blood vessels, and a reduction in inflammation. And that two-pronged approach is what makes them so effective at stopping a migraine in its tracks.
So they're addressing both the blood vessel component and the inflammatory component, which we know are both involved in migraine pain.
Exactly. But because of that vasoconstrictive effect, we have to be extra cautious in patients with any history of cardiovascular disease.
Right, that's a crucial consideration. We need to be thinking about those potential risks.
Always. Thorough patient assessment is paramount. Now, before triptans came along, ergot alkaloids were the mainstays of migraine treatment, but they've largely been replaced by triptans because they're generally safer and more effective.
Ergot alkaloids, I vaguely remember those from pharmacology. Didn't they have a higher risk of side effects?
They did. They work similarly to triptans by constricting blood vessels, but they're not as targeted. So they can cause vasoconstriction in other parts of the body, leading to some potentially serious complications. And they also have a higher risk of interacting with other medications.
So while they may still be used in some cases, triptans are definitely the preferred option for most migraine sufferers.
Agreed. Now, let's step back for a moment and talk about the nursing process as it applies to administering all of these different CNS stimulants. It's a systematic approach to providing patient-centered care, and it's crucial for ensuring medication safety and effectiveness. It's something you're already familiar with, but it's always worth revisiting.
Oh, absolutely. The nursing process, it's our roadmap, our guide. Assessment, diagnosis, planning, implementation, evaluation. Those 5 steps are essential for every patient, every medication.
And when it comes to CNS stimulants, each step takes on even greater significance because of those potential risks and the fact that we're often dealing with controlled substances. So let's walk through each step and see how it applies to these medications.
Okay, let's do it.
So assessment, that's always our starting point. Gathering all that essential information about the patient, their medical history, any current medications, allergies, lifestyle factors, social and environmental influences. We need that complete picture to make informed decisions.
It's like putting together a puzzle, right? All those pieces of information help us understand the patient as a whole.
Exactly. And for CNS stimulants, we pay particular attention to certain areas. Cardiovascular health, that's crucial because of the potential for increased heart rate and blood pressure. Mental health history, we need to know if there's any history of anxiety, depression, or substance abuse. Those are red flags. And, of course, any history of substance abuse in general is something we need to be aware of.
We're always looking for those potential red flags, those things that might make a medication less suitable or increase the risk of complications.
Precisely. Once we have that comprehensive assessment, we move on to diagnosis. This is where we analyze that assessment data and identify the patient's specific healthcare needs. It's about connecting the dots.
So, for example, if we're considering a stimulant for ADHD, our diagnosis might be impaired social interaction or risk for injury related to that hyperactivity.
Exactly. And if we're considering an anorexiant for weight loss, our diagnosis might be imbalanced nutrition more than body requirements. We're essentially putting a label on that problem, that need that we're going to address.
And those diagnoses then guide us as we develop the care plan.
Right. The planning stage is all about setting goals and figuring out those interventions that are going to help us achieve those goals.
So, for that ADHD patient, our goal might be to improve their ability to focus and control those impulses. And our interventions might include medication, of course, but also behavioral therapy, educational support is often a multi-pronged approach.
And for the patient receiving an anorexiant, our goal might be to help them achieve and maintain a healthy weight. So our interventions might include medication, dietary counseling, encouraging them to engage in regular physical activity again. It's about that comprehensive approach.
So we've assessed, diagnosed, planned. Now it's time for action, the implementation phase.
Exactly. This is where the rubber meets the road. We're administering the medication, of course, making sure we're doing it correctly, following all those safety protocols. But it's also about providing that clear, concise patient education, answering their questions, addressing their concerns, making sure they understand the medication, the potential side effects, what to watch out for.
And it's not a one-time thing, right?
Yeah.
That education is an ongoing process. We're constantly checking in, reinforcing those key points, making sure the patient feels heard and supported.
Absolutely. And of course, we're monitoring their response to the medication, looking for those therapeutic effects, but also keeping a close eye out for any adverse reactions.
And that brings us to the final step. Evaluation. It's about stepping back and asking ourselves, is this working? Are we meeting those goals we set?
Exactly. Are we seeing the desired effects? Are there any side effects we need to address? Are we making progress? And based on our evaluation, we might need to adjust the dosage, change the medication, or implement additional interventions. The nursing process, it's a dynamic, ongoing cycle. We're constantly assessing, evaluating, adjusting.
Always adapting to the individual patient's needs. And speaking of individual needs, let's talk about those legal and ethical considerations that are so important in nursing practice, especially when we're dealing with CNS stimulants.
Oh, absolutely. Legal and ethical issues, they're woven into the fabric of everything we do. And when it comes to CNS stimulants, which are often controlled substances, those considerations become even more crucial. We have a professional and legal responsibility to handle these medications with the utmost care to ensure they're being used safely, responsibly, and ethically.
It's about protecting our patients, but also protecting ourselves, right? Making sure we're practicing within the boundaries of the law and our professional code of ethics.
Exactly. And there are some key principles that guide our actions. Beneficence, that means always acting in the best interests of the patient, making sure the medication is being used for a legitimate medical purpose, that the benefits outweigh the risks. Non-maleficence, that's about avoiding harm, being aware of those potential side effects, taking steps to minimize them, and of course, being vigilant for any signs of misuse or dependence.
Right. It's about that delicate balance between providing benefit and minimizing harm. Always being aware of both sides of that equation.
And then there's autonomy. That's about respecting the patient's right to make decisions about their own health care, providing them with all the information they need to make those decisions, even if we don't agree with their choices. And for controlled substances, the principle of justice comes into play as well.
Justice. How does that apply here?
Well, it's about ensuring fair and equitable access to healthcare resources, avoiding discrimination in prescribing practices, advocating for policies that promote access for all. And then there are those legal considerations specific to medication administration. Informed consent, that's essential. Making sure the patient understands what they're taking, why they're taking it, the potential risks and benefits, and their right to refuse. And then there's confidentiality, protecting the patient's privacy, keeping their medical information safe and secure.
Those are all crucial considerations. And of course, documentation, that's essential too. Every detail matters.
Absolutely. Accurate and complete documentation is not just about paperwork. It's about accountability, transparency, and ensuring continuity of care. We need to document the medication name, the dosage, the route of administration, the time, the patient's response, everything. And we need to do it clearly and accurately every single time. It's our legal and professional responsibility.
Now let's shift gears again and talk about patient education. It's a cornerstone of nursing practice, and it's especially important when we're dealing with CNS stimulants.
Couldn't agree more. Education is key. It's about empowering patients to take an active role in their health care, to make informed decisions, and to manage their medications safely and effectively.
And with CNS stimulants, there's a lot to cover, right?
There is. First and foremost, we need to explain the purpose of the medication. What is it for? How does it work? And we need to do it in a way that makes sense to the patient. No medical jargon, just clear, straightforward language.
Meeting them where they are, so to speak.
Exactly. And we need to be upfront about those potential side effects. What are the common ones? What are the less common but more serious ones? And what should they do if they experience any adverse reactions? It's about giving them the knowledge they need to be their own advocates.
And providing tips for managing those side effects, right? Like
Mhm.
taking the medication with food to reduce nausea or avoiding caffeine to prevent insomnia.
Absolutely. Those practical tips can make a big difference. And then there's the importance of adherence, taking the medication as prescribed, not skipping doses, not taking extra doses, understanding those potential consequences. And for controlled substances, we need to talk about safe storage and disposal.
Right. Keeping it out of reach of children, disposing of it properly. Those are essential safety messages.
And we need to be aware of potential drug interactions, reviewing that medication list carefully, advising patients to avoid anything that could interact with the CNS stimulant. And for patients taking stimulants for ADHD or narcolepsy, driving safety is a big one.
Because those medications can affect alertness and reaction time, right?
Exactly. Even if they feel alert, their judgment and coordination might be impaired. It's a safety issue we can't ignore. And for any CNS stimulant, we need to talk about the potential for withdrawal symptoms if the medication is stopped abruptly.
So tapering off gradually under the guidance of their healthcare provider is usually the best approach.
And explaining those potential withdrawal symptoms, fatigue, irritability, difficulty concentrating so they know what to expect. And finally, emphasizing the importance of follow-up care, keeping those appointments, checking in with their provider, reporting any changes or concerns. That's all part of that ongoing communication and monitoring.
It's a partnership, really. Patient and provider working together to achieve the best possible outcomes. Now let's talk about some of the challenges and controversies surrounding CNS stimulant use. These medications have been both hailed as miracle drugs and demonized as dangerous substances, and it's important to approach these discussions with a balanced, evidence-based perspective.
Absolutely. We need to acknowledge the undeniable benefits of these medications. For people with ADHD, narcolepsy, certain other conditions, they can be truly life-changing, improving focus, reducing fatigue, enhancing quality of life. The benefits are real.
But we can't ignore those potential downsides, right? The misuse, the dependence, the side effects. It's a complex issue.
It is. And one of the biggest controversies is the use of stimulants in children. There are concerns about the long-term effects on developing brains, the potential for addiction later in life. Those are valid concerns that require ongoing research and careful consideration.
Right. And we need to be mindful of the potential for overprescribing, making sure these medications are being used appropriately, not just as a quick fix for every behavioral issue.
Absolutely. And then there's the issue of abuse and diversion. These medications can be highly sought after on the black market, and that's a serious public health concern. We need to be aware of that risk, be vigilant for any signs of misuse, and advocate for policies that promote responsible prescribing practices.
It's a multifaceted issue for sure. Now let's shift gears again and talk about some of the exciting developments in CNS stimulant research. The field of pharmacology is constantly evolving, and there are always new discoveries on the horizon.
Oh, absolutely. There's a lot to be excited about. One area of active research is the development of non-stimulant medications for ADHD. Atomoxetine is one example, but researchers are exploring other options that target different neurotransmitter systems.
So, providing more choices for patients who can't tolerate stimulants or who are concerned about those potential risks.
Exactly. And for narcolepsy, while modafinil is currently the gold standard, researchers are looking at other medications that work in different ways, as well as investigating new approaches like gene therapy. And in the world of migraine treatment, there's a lot of focus on developing new medications that are more effective for preventing migraines rather than just treating them once they occur.
Right, those CGRP inhibitors we talked about earlier, those seem promising.
They do. And there's growing interest in non-pharmacological approaches as well, like
Mm.
biofeedback, acupuncture, lifestyle modifications. It's all about finding those different avenues for relief. And then there's the whole field of personalized medicine. That's an exciting frontier.
Personalized medicine, tell me more about that.
It's all about using genetic testing and other biomarkers to tailor medication selection and dosage to the individual patient. So we can predict how they're going to respond to a medication, minimize side effects, and get it right the first time. It's about moving away from that one-size-fits-all approach and really personalizing treatment.
That sounds incredibly promising. And we're also seeing technology playing a bigger role in CNS stimulant management, right?
Absolutely. Wearable devices, mobile apps, telehealth platforms, they're all being used to track medication adherence, monitor vital signs, provide real-time feedback. It's all about enhancing patient engagement, improving outcomes, and making healthcare more accessible. It's an exciting time to be in this field.
It sounds like it. So we've talked about the past, the present, the future of CNS stimulants. But before we move on, let's talk about you, the nurse. How can you best prepare yourself to safely and effectively administer these medications?
That's a great question. And the answer, as with so many things in nursing, is multifaceted. First and foremost, a solid foundation in pharmacology is essential. You need to understand those mechanisms of action, the effects, the side effects, the factors that influence how these medications work.
Right, it's not just about memorizing facts, it's about understanding the why behind those facts.
Exactly. And staying up to date is crucial too. New research is emerging all the time, new guidelines are being published. It's a lifelong learning process.
Nursing, it's
What?
all about lifelong learning.
Yeah.
And strong assessment skills are essential, right?
Absolutely. Before you even think about giving a medication, you need to know that patient inside and out. Their medical history, their current medications, their vital signs, any red flags. It's about putting all those pieces together to make informed decisions.
And then there's dosage calculation. That can be a bit daunting for some nursing students, but it's absolutely crucial.
It is. You need to be comfortable converting between units of measurement, calculating dosages based on weight or body surface area, double-checking your work, and knowing those safe dosage ranges is paramount.
And don't be afraid to ask questions, right? If something seems off, if an order doesn't look right, speak up. It's about patient safety, first and foremost.
Absolutely. Communication is key in every aspect of nursing. Being able to communicate clearly and effectively with patients, families, other healthcare providers, that's essential. And patient education, that's a huge part of our role, providing that clear, concise information, answering questions, addressing concerns.
Empowering those patients to be active participants in their care.
Exactly. And for CNS stimulants, monitoring is crucial, watching for those therapeutic effects, but also being vigilant for any adverse reactions, knowing what to watch out for, how to intervene if something goes wrong. And medication reconciliation, that's another important piece, making sure that medication list is accurate and up to date, catching any potential interactions or duplications.
It's like being a detective sometimes, right? Piecing together all those clues, making sure everything makes sense. And when it comes to controlled substances, safe handling and storage are paramount.
Absolutely. We need to follow those procedures meticulously. Storing meditation securely, documenting every transaction, watching for any signs of tampering or theft, and educating our patients about those same principles: safe storage, proper disposal.
And at the end of the day, it's all about being an advocate for our patients. Speaking up for them, making sure their needs are met, ensuring they receive safe and compassionate care.
That's the heart of nursing, isn't it? Advocacy, compassion, that unwavering commitment to our patients' well-being. It's what drives us.
Okay, let's shift gears one last time and put all that knowledge to the test. It's time for our favorite segment review questions.
Excellent. Let's see what you've retained from our deep dive. And remember, these questions aren't just about passing a test. They're about solidifying your understanding, preparing you for those real-life nursing scenarios you're going to encounter.
So first question. A patient with narcolepsy is starting treatment with a central nervous system stimulant. Which of these adverse effects would we expect to see? And remember, this is a select all at apply question. So our options are bradycardia, anxiety, increased blood pressure, tremors, or drowsiness at night.
All right, let's think this through. First off, bradycardia, that's a slow heart rate. And CNS stimulants typically do the opposite. They increase heart rate and blood pressure, so we can safely rule that one out.
Okay, bradycardia is out. What about anxiety?
Anxiety is definitely a common side effect of CNS stimulants, especially at higher doses, so that's a likely one.
Got it. Anxiety is in. Now, increased blood pressure, we kind of already touched on that, right?
They did. And as we said, CNS stimulants tend to increase both heart rate and blood pressure, so that's another one to watch out for.
Okay, increased blood pressure is on the list. What about tremors?
Tremors are also a possibility, particularly with higher doses, so that's another one to keep in mind.
Tremors, check. Now, drowsiness at night, that seems counterintuitive, right? Since these medications are supposed to promote wakefulness.
It does seem a bit odd, but it's actually a possible side effect. CNS stimulants can sometimes interfere with sleep patterns, even if they're helping someone stay awake during the day.
So it's not a guarantee, but it's something to be aware of.
Right. So our expected adverse effects for this patient would be anxiety, increased blood pressure, and tremors. And drowsiness at night is also a possibility, while bradycardia is highly unlikely.
All right, on to question number 2. A patient at a weight management clinic was prescribed Orlistat. Now, they called the clinic hotline complaining of a terrible side effect. What do you think they're talking about? Our options are nausea, sexual dysfunction, urinary incontinence, or fecal incontinence.
This one requires a bit of recall about orlistat's mechanism of action. Remember, it works by blocking fat absorption in the intestines.
Right, so whatever side effect they're experiencing is likely related to that fat passing through undigested.
Exactly. And the side effect most commonly associated with orlistat is, well, fecal incontinence. That unabsorbed fat can lead to oily stools, urgency, and sometimes, unfortunately, accidental leakage.
Definitely not a pleasant conversation to have, but an important one nonetheless.
Absolutely. Honesty and clear communication are key. Patients need to be prepared for those potential side effects, even the embarrassing ones.
Okay, question number 3. We're developing a care plan for a patient receiving an anorexiant. Which of these human needs statements is most appropriate? Altered oxygenation, altered sexual needs, altered freedom from pain, or altered food and nutrient intake?
Well, considering anorexins are appetite suppressants, the most relevant statement would be altered food and nutrient intake.
Makes sense. It's directly related to the medication's primary effect.
Exactly. We need to be mindful of those potential nutritional deficiencies that can occur when someone's food intake is significantly reduced.
All right, question 4. A patient has a new prescription for sumatriptan. What key information should we include in our patient teaching about self-administration? Take the medication before the headache worsens, allow at least 30 minutes between injections, take no more than 4 doses in a 24-hour period, or correct technique for intramuscular injections.
Okay, let's break it down. First, sumatriptan is not typically given intramuscularly. It comes in oral, nasal spray, and subcutaneous injection formulations. So we can eliminate that option.
IM injections are out. What about taking the medication before the headache worsens?
That's absolutely correct. Triptans are most effective when taken early in a migraine attack, at the first sign of symptoms. Waiting until the pain is severe reduces their effectiveness.
So early intervention is key.
Exactly. Now, allowing 30 minutes between injections, that's not quite right. The specific time interval depends on the formulation and the individual patient, but 30 minutes is usually too short.
And taking no more than 4 doses in 24 hours.
That's also not a universal rule. The maximum dosage and frequency can vary, so patients need to follow their healthcare provider's specific instructions. It's all about individualized care.
So the key takeaway here is to take the medication early, at the first sign of a migraine, and always follow those specific instructions from the healthcare provider.
Absolutely. Now for question 5, we're reviewing the history of a patient who's going to start sumatriptan for migraines. Which of these conditions, if present, would be a contraindication to triptan therapy? Cardiovascular disease, chronic bronchitis, history of renal calculi, or diabetes mellitus type 2?
This one calls for thinking about those potential risks of triptans. And the biggest concern is that vasoconstriction, that narrowing of blood vessels. So which condition would be most affected by that?
Definitely cardiovascular disease. Triptans can put extra stress on the heart, so they're generally avoided in patients with heart conditions.
It's all about that risk-benefit analysis, right?
Exactly. We always need to weigh those potential risks against the potential benefits. And for someone with cardiovascular disease, the risks of a triptan might outweigh the benefits of migraine relief.
Okay, question number 6. We're reviewing medication therapy with the parents of an adolescent with ADHD. Which of these statements are correct? And again, this is a select all that apply. So our options are: be sure to have your child blow his nose before administering the nasal spray. This medication is used only when symptoms of ADHD are severe, The last dose should be taken 4 to 6 hours before bedtime to avoid interference with sleep. Be sure to contact the physician right away if you notice expression of suicidal thoughts. We will need to check your child's height and weight periodically to monitor physical growth. Or, if adverse effects become severe, stop the medication for 3 to 4 days.
All right, let's go through these one by one. The first statement about blowing the nose before a nasal spray is only relevant if the ADHD medication is actually a nasal spray, so it's not a universal truth.
Okay, that one's a bit tricky. It depends on the specific medication.
Right. Now, the statement about using medication only for severe symptoms, that's incorrect. ADHD medication is prescribed based on the individual child's needs and how those symptoms are impacting their life, not just on the severity.
So it's about the overall impact, not just the symptom intensity.
Exactly. Now, the statement about taking the last dose 4 to 6 hours before bedtime, that's absolutely correct. Stimulants can interfere with sleep, so timing that last dose is crucial.
Good sleep hygiene is important for everyone, especially kids with ADHD.
Agreed. And the statement about contacting the physician if suicidal thoughts emerge, that's also essential. Suicidal ideation can be a rare but serious side effect of some ADHD medications, so seeking immediate medical attention is crucial.
Never hesitate to reach out to the healthcare provider if something seems off.
Absolutely. Now, the statement about monitoring height and weight, that's also correct. Stimulants can suppress appetite and potentially affect growth, so regular checkups are important.
So we're looking at the whole picture, not just the behavioral symptoms.
Right. And the final statement about stopping the medication for a few days if side effects occur, that's incorrect. Abruptly stopping ADHD medication can lead to withdrawal symptoms and other problems. It's always best to consult with the healthcare provider before making any changes.
So our correct statements are taking that last dose well before bedtime, contacting the physician immediately if suicidal thoughts emerge, and monitoring height and weight regularly.
Exactly. Those are the key takeaways for parents of children with ADHD.
All right, onto a dosage calculation question. The order reads, atomoxetine 1.2 millimillic a day in 2 divided doses. The child weighs 66 pounds. How much will be given with each dose?
Okay, first things first, we need to convert that weight from pounds to kilograms. Remember, there are 2.2 pounds in a kilogram, so 66 pounds divided by 2.2 gives us approximately 30 kilograms.
Got it. 30 kilograms. Now what?
Now we multiply that weight in kilograms by the prescribed dosage, which is 1.2 milligram per kilogram per day. So 30 kilograms times 1.2 milligrams per tile a day equals 36 milligrams per day.
36 milligrams total for the whole day.
Right. And the order specifies 2 divided doses. So we divide that total daily dose by 2.
Which gives us 18 milligrams per dose.
Exactly. So the child will receive 18 milligrams of atomoxetine with each dose. And remember, accurate calculations are essential for safe medication administration.
Always double check that math. All right, last question. A patient with narcolepsy is having trouble with excessive daytime sleepiness. Which medication would we expect to be prescribed to help them stay awake? Phentermine, amitriptyline, modafinil, or methylphenidate?
Well, for narcolepsy and excessive daytime sleepiness, the most likely choice is modafinil. It's a wakefulness-promoting agent specifically designed for this condition.
It's all about using the right tool for the job, right?
Absolutely. While methylphenidate can also be used for narcolepsy, it's primarily an ADHD medication. Phentermine is an anorexiant, so it wouldn't be appropriate here. And amitriptyline is a triptan used for migraines. So modafinil is our best bet for this patient.
That concludes our review questions for today. I hope you found them helpful and, dare I say, a little bit fun.
Fun is always good. Learning should be engaging, right? And I think these questions really helped reinforce those key concepts we covered today.
I agree, but remember, this is just the tip of the iceberg. The world of CNS stimulants is vast and complex, and there's always more to learn.
Absolutely. Nursing is a journey of lifelong learning, and pharmacology is a constantly evolving field. So stay curious, stay engaged, and never stop asking questions.
That's the perfect note to end on. Thank you so much for joining us on this deep dive into the fascinating world of central nervous system stimulants. As always, we appreciate you tuning in to the Vital Signpost. And until next time, stay curious, stay informed, and stay well.